Audible as well.
Thank you. Namaste. I am Manuswini Keshav, a medical student from Ramaya Medical College. Today, I will be presenting my study on the topic COVID-19 convalescent children, outcomes after congenital heart surgery. Of late, COVID-19 convalescents seems to be the predominant population approaching congenital heart surgery programs. Hence, it is crucial to understand their outcomes for risk stratification and optimization prior to congenital heart surgery. In our study, we observe mortality and post-operative outcomes of COVID-19 convalescent phase children undergoing congenital heart surgery. We performed a retrospective observational cohort where all patients undergoing congenital heart surgery from October 2020 to June 2021 were included in the study. On the day of the surgery, we categorized patients into two groups, COVID convalescent and control. Convalescent were those without any symptoms related to COVID-19, with or without RT-PCR positivity 6 weeks prior to surgery, and or are positive to the COVID-19 IgG antibody that is targeted against the SARS-CoV-2 S protein. COVID control with those children with negative RT-PCR and negative COVID-19 IgG antibody. Neonates were excluded from the study. Demographics, clinical profile, intraoperative details, and postoperative outcomes were compared among both the groups. We found that out of 1,129 patients who underwent congenital heart surgery, 349 were categorized as COVID convalescent and 780 as COVID control. Among COVID-19 convalescents and control groups, age at surgery and body surface area reached significance while using the Mann-Whitney test. Demographic data, clinical and surgical data like median RAC score, cardiopulmonary bypass, and reduced sternotomy was not found to be significantly different. The in-hospital mortality was not significantly different in both the groups too. The following post-operative outcomes, like the need to perform emergency surgeries, re-exploration, ECMO, and occurrence of cardiac arrest in the ICU were not significantly different. Other post-operative outcomes like post-operative ventilation hours, need for inhaled nitric oxide and reintubation were no higher. Quality indicators supported comparable outcomes in convalescents on par with the control. Indicators of extended infection markers like hospital stay, ICU stay, and readmission to the ICU were no higher in COVID convalescent children. When confounding factors were analyzed by multiple regression analysis, age was not significantly associated with mortality. COVID-19 convalescence was not associated with higher odds of mortality in the regression model. There was no significant difference in mortality across various RAC surgical categories. Now, why did we speculate on COVID-19 convalescent children? It is globally observed that children with congenital heart disease who had encountered COVID-19 had worse outcomes. Similar results were obtained in an Indian perioperative study. The outcomes of these children worsened with the presence of COVID-19 in them, irrespective of the fact that they underwent surgery or not. An Indian multi-center analysis showed that the risk of undergoing surgery with active COVID-19 infection was associated with mortality that increased by more than 2-fold and an in-hospital mortality that almost doubled during the pandemic. This created a concern of COVID-19 in congenital heart disease. It indicated a worse outcome of COVID-19 when children underwent congenital heart surgery, which is why we speculated on COVID-19 convalescent children. COVID-19 extends its manifestations to multisystem inflammatory syndrome in children, which is a concerning entity in children, especially with cardiac involvement, that has caused significant debilitation as evidenced by left ventricular dysfunction, coronary artery abnormalities like ectasias and aneurysm, or elevated cardio biomarkers like troponin or proBNP. In our study, we found that COVID-19 convalescents did not have unfavorable outcomes. There was no increased risk of mortality, neither was there increase in serious morbidity in children undergoing congenital heart surgery, with clinical implications being that COVID-19 convalescents can be considered a safe time to undergo congenital heart surgery. We concluded that children with IgG antibodies to SARS-CoV-2 S protein deemed as COVID-19 convalescents are not at an increased risk of mortality and worse outcomes after congenital heart surgery. IgG antibody presence on preoperative screening for congenital heart surgery can be used as a screening tool in aiding perioperative decision-making and risk stratification. I would like to thank Dr. Sridhar Joshi and Dr. Shruti Rao, under whose mentorship I was able to perform to my fullest potential. Thank you.
Thank you.